Hello, everyone. Welcome to the podcast Speaking English with John. If speaking English stresses you out, if you're worried about being judged, this podcast is for you. Here, no perfect sentences. Instead, just one key: knowing how to stress the right word. The emphasis to make yourself understood, even with simple vocabulary. I'm John, and every day we practice together to transform your anxiety into ease. Let's begin. Today, we're going to practice your medical English. We'll use the best technique for speaking: shadowing. Listen, then immediately repeat after me, copying my rhythm and emphasis. Don't try to understand everything. Just whisper, speak normally, or speak loudly. But don't just repeat in your head. Your brain and your mouth must work together to build this new muscle memory. Let's go. Guide. Repeat after me. I do not feel very well this morning. Repeat after me. I have a really terrible headache today. Repeat again. My throat is extremely sore when swallowing. Now your turn alone. I think I need to see a doctor immediately. I am calling the medical clinic right now. I need to make an urgent doctor appointment. The receptionist answers my telephone call. I explain all my symptoms in detail. I feel very tired throughout the day. My entire body aches quite badly. I think I might have a high fever. I cannot sleep properly at night. I feel quite nauseous after meals. I have absolutely no appetite lately. I feel dizzy when getting up. My nose has been constantly runny. Keep sneezing every few minutes. I have developed a persistent cough. My chest feels uncomfortably tight. I am having difficulty breathing normally. All my muscles feel extremely sore. I feel chills running down my spine. I am sweating excessively at night. I feel extremely weak and fatigued. I notice a strange rash on my skin. My joints feel painfully stiff today. I get frequent headaches recently. I experience blurred vision occasionally. I hear constant ringing in my ears. I feel numbness in my fingertips. 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 I feel numbness in my I have trouble swallowing solid food. The pain radiates to my lower back. I have always had very sensitive skin. I feel sharp pain in my abdomen. My head throbs when moving suddenly. I feel pressure in my nasal sinuses. My back aches when standing long. Alternate between hot and cold. I need to rest frequently today. I cannot focus on my work. I feel generally unwell today. My symptoms began yesterday morning. Guide. Think only in English now. My appointment is at 10 o'clock. I arrive at the clinic early. I check in at the reception desk. I fill out the medical forms. I wait patiently in the waiting room. The nurse calls my full name. She takes my temperature first. She checks my blood pressure next. She weighs me on the scale. She measures my height too. The doctor enters the room now. He asks about my symptoms. I describe all the pain. Started yesterday morning. The pain is very sharp. Gets worse at night. I point where it hurts. I have asthma history. I am allergic to penicillin. I take daily medication. My family has heart disease. My blood sugar is high. The doctor examines me. He listens to my chest. He looks in my ears. Tip moment. Let's take a moment to assimilate what we've learned. Repeat your favorite phrases from this lesson to yourself. Ready to continue practicing? Take a breath, clear your mind, and let's continue. He checks my throat. He feels my stomach. He tests my reflexes. He asks deep breathing. I follow instructions. He looks concerned. He needs more tests. Hospital care. I feel nervous now. He writes a referral. Take the paper. I leave the clinic. I drive to hospital. I find parking space. I enter emergency. I approach reception. I show my documents. I provide information. I wait for calling. Guide. Use English daily. A nurse takes me to a room. She asks about my medications. I list all my allergies carefully. She takes my blood pressure again. She checks my oxygen saturation level. She takes multiple blood samples now. She puts on a tourniquet first. She cleans the area with alcohol. I feel a small, sharp pinch. She collects several vials of blood. She places a bandage on my arm. The emergency doctor arrives now. He reviews all my symptoms again. He examines my throat closely. He listens to my lungs carefully. He checks my heart with stethoscope. He presses on my abdomen gently. He orders an immediate X-ray. Also requests blood tests. Go to the radiology department. Check in at their front desk. I wait in another waiting room. I wait for my turn patiently. The technician calls my full name. He explains the entire procedure. He asks me to remove my necklace. I need to take off my jewelry. I put on a blue hospital gown. The gown ties in the back. I lie on the cold exam table. The technician positions me correctly. He tells me to raise my arms. The machine takes several pictures. I need to hold my breath now. I must stay completely still. The technician leaves the room. I hear a loud buzzing sound. The machine moves around me. The test is very quick. The technician returns to help. He says the images look good. I can get dressed again now. I feel relieved it's over. I return to the emergency room. The test is completely finished now. Get dressed quickly. I return to the waiting area. I wait for the test results. The doctor calls me back in. He shows me the X-ray images. He points to a specific area. He explains his medical findings. I have a chest infection. I need antibiotics immediately. He writes a detailed prescription. I need complete rest for recovery. I should drink plenty of fluids. I need a sick note for work. Can I have a medical certificate? I need to return if symptoms worsen. I go directly to the pharmacy. I give them the prescription paper. I wait for the medication preparation. The pharmacist explains the dosage. I need to take 2 pills daily. I should take them with food. I must finish all the medication. I cannot skip any doses. There are possible side effects. I should avoid alcohol completely. I take the medicine home. I read the instructions carefully. I follow the directions exactly. I take the first dose now. I start to feel better. Slowly. My fever goes down gradually. The pain decreases each day. I can sleep much better. My appetite returns slowly. I have more energy now. The cough improves daily. I breathe more easily. I need a prescription refill. I finish all the medication. I feel almost normal again. I schedule a follow-up visit. I continue my recovery process. I feel grateful for treatment. Guide. How do you feel? I need to update my vaccination record. I need to monitor my blood pressure regularly. I eat healthy and balanced foods now. I exercise gently every morning. I avoid all unnecessary stress. I get enough sleep each night. I drink more water throughout the day. I wash my hands very often. I avoid people who are sick. I take vitamins every day. I feel much stronger now. My immune system is better. I have regular medical checkups. I monitor my health closely. I know the warning signs well. I act quickly when feeling sick. I trust my doctor completely. I ask many questions during visits. I understand my treatment plan. I am very proactive with health. Control of my health. My health is my top priority. I need to see a specialist soon. Can you refer me to a cardiologist? I need physical therapy sessions. I need a dental checkup soon. I have a slight toothache sometimes. My gums bleed when brushing. I feel very confident in English. I can handle medical situations. I know important medical vocabulary. I can describe my symptoms well. I understand medical terms better. I feel well prepared for visits. My English keeps improving daily. I feel more confident at appointments. I can explain symptoms clearly. I understand instructions better. I feel less nervous in hospitals. I know what to say in emergencies. Ask the right questions. I understand doctors' explanations. Feel comfortable with medical English. Can describe pain accurately. I know how to make appointments. I can discuss my medical history. I understand prescription instructions. I feel empowered about my health. My pronunciation is improving. I remember important phrases. Feel ready for my next visit. I am grateful for good care. The doctor was very helpful. The nurses were extremely kind. The hospital was very clean. The treatment was effective. I am glad I went early. Health is very important. We'll take better care. Feel so grateful today. Keep practicing these phrases. Use them in real situations. Do not fear speaking English. Guide. Great job, we finish soon. Your health is important. Be proactive about care. Always ask questions. Understand your treatment. Take care of yourself. Stay very healthy. Wait 1 minute, please. Forgot to take medicine. Congratulations on completing this lesson. And remember, the goal isn't perfection. It's pronunciation and emphasis. Knowing where to place intonation is a major step forward. This is John. Thank you so much for practicing with me today. If this episode helped you, please subscribe, like, and share it with a friend who might need it. I would love to know what topic would you like to explore next? Tell me in the comments below. Until next time, keep practicing every day, everywhere. And remember, progress over perfection. See you to the next episode.